Joining me now on this episode of Locally Sourced CP is the owner of the El Paso Pelvic Health, Miss Dr. Elizabeth Willison. Dr. Wilson, thank you for joining me today.
Thanks for having me.
I appreciate you coming on, and I thank you for helping me with your last name because I just didn't want to butcher it. So thank you, sir. It's Dr. Willison.
Yes. You can just call me Elizabeth.
Elizabeth, thank you. So I appreciate that. We're here to talk about your practice, which opened up February 2020, the El Paso Pelvic Health. So what kind of health do you guys talk there?
Yeah, well, we are El Paso's only pelvic rehab specialty physical therapy clinic. So we don't treat just like, you had shoulder surgery or knee surgery you need help with. We actually just specialize in pelvic floor dysfunction and specific to more pelvic related issues. So pelvic dysfunction or pelvic floor dysfunction is typically defined as urinary issues, bladder, meaning bladder or urine issues, bowel dysfunction, or issues with the pelvic floor with sexual activity. So we really focus in those areas. Basically, all the things that people don't ever want to talk about, that's what we deal with every day.
Oh, wow. You're right. A lot of people, that's almost like an uncomfortable conversation. But I mean, how important is that type of health for a person?
Yeah, so important, right? It's easier to have a broken arm in some substances because you actually see it versus if you're struggling with having to go to the bathroom every 15 minutes or this chronic pelvic pain that nobody can really find an answer to, or this hip pain that won't go away, or you're having issues with intimacy, or, you just thought you were passing gas and something else came out, and it happens to you a lot, right? Those are things that it's hard to talk about and it's hard to get help for. And that's what we do every day.
And this something like this isn't just an issue with male or female. It's both
Yeah.
sexes, right?
Yeah, we've seen all genders and in all stages of life, really, too. There is in our clinic, we probably see about 80% of those that identify as female, and then 20% male, give or take. We see a high incidence of like a 20, 30-year-old male pelvic pain. Maybe it's like testicular pain or penile pain or issues with erectile dysfunction, things like that. And then we have like another big kind of peak around probably about 60, 70 years of age when they're starting to have more prostate issues and maybe they had surgeries on the prostate and then things just aren't getting better. So more like leakage or urinary issues with that one, tailbone pain, things like that for males. But we still see like urgency, frequency for urination in like throughout the spectrum of life with males. Right. We see a lot of pregnant, postpartum females, like I think people just assume if you're pregnant, it's normal to have pain, but it's not. So we still do physical therapy for all those things too. Ab separation afterwards or getting you back into physical activity. We do that too in postpartum. And, if somebody sprains their knee, like it happens an ACL sprain or something like that during a football game, or they hurt their shoulder, everybody makes a big deal about it, right? But then if you push like a 10-pound bowling ball through your pelvis, everyone just expects you to just care for that infant and yourself. Yeah, just the next hour, right? Like everything's just continues. And there is a lot of trauma that occurs in the pelvis and can occur during pregnancy, postpartum. So having someone really help you get back to feeling like you did before and not feeling like now you're broken or you have to pee your pants forever now whenever you cough or sneeze, because that's not normal either, Yeah. So it's important.
That's something that you're right. That's something that like people might not be comfortable talking about, but it seems like so important, like a conversation almost not everyone should have about their health.
Mm-hmm. Yeah, totally. I mean, and it's hard. we really try hard to keep a safe space at the clinic so people do feel comfortable talking about these things, but we also acknowledge these are just hard subjects to talk about, and they're really hard to bring up to your providers as well. Or if you finally do get the courage to talk to them about it, they might know where to send you or what to do with you, other than maybe send you with some medication, you know.
Yeah.
So having the knowledge that we're out there too, that you can just give us a call, ask for a referral if you need one for your insurance, you know. But if you've done physical therapy before, it's just similar to that. And
if you don't mind, Liz, can you talk a little bit about how you got started and how you got into this type of field?
yeah, in physical therapy school, I learned, there was this field that was kind of newer, people were getting into, and originally it was termed women's health.
Mhm.
And, that we just focused on pregnancy, postpartum, those things. And when I learned in physical therapy school that you don't actually have to leak when you sneeze and it's not normal for these things to happen, it just became really eye-opening for me, because I'd always grown up with all my little, like in El Paso, we call them like tias and stuff, right? Like all the people in my life that always tell me, like, oh, just you wait, this is going to happen to you. This is normal, right? Like they'll cough during cold season and then they'll run to the bathroom or something like that. And to find out that actually that isn't normal and we can do something about it. And it was just really igniting for me of this passion that I just became more interested in, learned more about, and started taking all the courses to learn more, studying, researching, and then eventually treating in that capacity, and then opening our own clinic here in El Paso.
That's awesome. How does it feel to be able to help people with this type of problem when they've kind of like, oh, this is part of life, but then when you're able to help them, they're like, what? I mean, how does that make you feel to be able to help someone out like that?
Oh, I mean, there's nothing like it. I used to teach as well, and teaching is very rewarding. But then if you can help someone through a problem that nobody can see, and this shame that they carry that they're broken and no one else feels like that, and just help them live a better quality of life. Because when you can't poop, like that's huge,
Yeah, it is.
Like, like if you don't think about it until you get to that other side and you're like, wow, this is great over here. Like that was just so bad on that other side. And thanks for helping me get there. It's just those little things that a lot of people take for granted, that when you lose, it's really hard in your day-to-day life. So it's incredibly rewarding.
Oh, that's so awesome. Just hearing like someone so passionate in their field and just being able to help someone and the way they feel so rewarded and being able to help it just makes you feel good that there's still people out there like that. And I know I'm not a patient of yours or anything, but I thank you for doing that for everybody. And it's just so awesome to hear that there's still doctors like you out there and being able to help people like that.
Yeah, I mean, I would want this for my own grandparents. Like, I don't have any living grandparents right now, but I would want like my grandparents to come here. Like, I've been able to help family members, but also send them to people near them, and just I want everybody that I care about to experience something like this, to have somebody check them and see, they feel like their insides are falling out. Like, let's talk about that. Let's look at what's going on. Like, let's talk about these things and get you the help, because it's not something you should have to live with.
Right. Oh, that's so awesome. I mean, it just like this is on. I'll be honest. This is the first type of interview I've done with a business like yours, and
Mhm.
it's just so this and just so interesting and amazing that you're able to help your patients like that.
Yeah, I mean, people don't even know. I mean, one, they don't know that it exists in El Paso, right?
Mhm.
And two, that if they do know anything about pelvic rehab or pelvic floor at all, it's very rare. And so there's a lot of misconception out there too, that all pelvic floor physical therapy is just Kegels, when I see a lot of chronic pain, a lot of pelvic pain, and those people should not be doing hundreds of squeezes every day to try to get themselves stronger. That's not the answer. It's like you sprain your ankle and give you a handout that says just lift your foot up and down a million times a day, and that's not going to get you better, you know.
Oh, that's true. Yeah.
So
I'm and having some, athletic injury myself. That's true. I mean, it's not just rebuilding. There's certain steps you do have to take to make yourself feel better and get stronger. And it's not just like one thing. So yeah, you're totally right. And you're a doctor. You know what you're talking about.
I like to think so. I mean, I've lots of letters to prove that I know what I'm talking about. But at the end of the day, it's really just, I think it's just about caring about people. And, I truly do. Like, I invest a lot in my patients, and I spend a lot of time with them to get them from A to B, and if they want to start going to C and D, then we go there,
Yeah.
They realize, wow, I never thought I could like do yoga again or Pilates. Now, what about running? What about a marathon? And then we get them there,
Yeah, that's so awesome. I'll have to ask, like, what are some of the like, maybe, I guess, some signs or things people should look out for if they like maybe need to, if they're feeling a certain way, or what are some of the signs to look out for to maybe talk to their provider to maybe go see you, or to take care of themselves?
Yeah. So I brought my model. I don't know if this is going to actually show.
Oh, nice. That is awesome.
So this is the pelvis. Okay. The white part's the bones, right? Pubic bone in the front. This is assigned female at birth. So this has but the male also has all the same muscle, just external genitalia. So if you take away the labia and you look underneath, all of this red is muscle. Okay. So it wraps from the front pubic bone to the back. So this is where the spine was, and then tailbone here. So everything around it. So that's why it affects those three areas, because it can so the pelvic floor muscles encase the openings where the urine comes out, where vaginal opening, and then also where the like poop or feces come out. So you can have issues with any of those categories. You can have issues with urination, like urgency and frequency is a really big one, especially in absence of UTI. Like you could swear you have an infection, but you keep testing negative and you don't know why. Okay. A lot of times it's tight pelvic floor, or insertional pain with sexual activity or any kind of penetrating object like a tampon even. That's typically pelvic floor dysfunction. Whether that's insertion or deep penetration, typically pelvic floor dysfunction. And then defecation issues like we talked about, like fecal incontinence or just the inability to hold back gas, or know if it's gas or stool. And then constipation. So if these muscles are really tight back here, then it'll close the door, and then it's really hard to defecate through a closed door. And then it just kind of creates these issues. So you can have anal fissures and like tearing and hemorrhoids and things like that. Those are all signs of pelvic floor dysfunction. Hesitancy of urine stream, like you go and you're like, I could have sworn I have to go, but then I sit down or I stand there and nothing's happening. That's a sign of pelvic floor dysfunction. Splitting of the stream or like stop start. We have like a whole list on our form, and people don't realize, wow, all of these things are probably connected,
Yeah. I'm glad to put the word out. I mean, this is just such, like you said, a lot of people don't like to talk about it, but I think like you said, it's such an important thing to actually talk about, and to an issue, especially if you are having issues, to at least get it looked at and checked out.
Yeah, like maybe you're thinking something's wrong with you because you've never been able to orgasm, but maybe that's because pelvic floor isn't working like it should, because those muscles should be contracting as well, or they should have good enough blood flow for actual arousal. So sometimes that's more difficult in some cases. So we can look at that too.
Awesome. Again, Elizabeth, thank you so much. Where are you all located at? Would you better let me know where are you located, how people can contact you?
Yeah, so we are on the east side. We're at 11500 Pellicano Drive and in Suite A-9. And we also have and Instagram, and we dabble in TikTok a little bit, but that's EP Pelvic Health,
Mhm.
and our Facebook page as well. And then people usually just want to know, okay, well, one, do I need a referral to see you? And two, do you accept insurance? And it just kind of depends on your insurance for both of those things. In the state of Texas, we need a referral within the first couple of weeks of you starting physical therapy in general. But usually after an evaluation, we can just get that signed by your PCP or another provider, and it's fine. But certain insurances we do accept, and then others we'll just give you a receipt. You'll pay cash up front, and you can submit that to your own insurance for reimbursement or to go towards your deductible.
Right. And
So even if, oh, sorry, go ahead.
no, go ahead. Go ahead. Even if, I'm sorry, I apologize.
Even if you're out of network with, like, we're out of network with your insurance, a lot of times if you just had a baby or you've had all these procedures and testing done, and you've already met your deductible, then if we just give you a receipt, they'll reimburse you, 100% according to your plan.
Mhm.
So.
No, I would just say, even though it's sometimes paperwork and things can be daunting, I mean, it's always a good idea to, you need to make sure you take care of yourself. Like, so make sure that, especially if it's something that can be fixed and something that you make you be healthier and feel better about yourself.
Yeah, but I mean, I work with a lot of people who stop doing things. I mean, I mentioned like jumping and running. People stop doing that. They stop jumping on a trampoline, or they stop leaving their house because they get to a point where, like, they already know where every bathroom is in the city, and they know, like, if they're in the front of the store, they can't make it to the back in those bathrooms if they have that sudden urge. So then they just stop going places. And then you really limit your day-to-day activities, your environment, your quality of life. And just, it opens doors for you to get these things looked at and fixed.
Oh, I thank you for being on. It's just so cool, like, and amazing to have someone on that's so passionate about what they do. I mean, like, my 9 to 5, I make videos, and that's just, that's something that I love to do. And it's great that you're so passionate about helping people. And it's just so cool it's just so cool to speak with you and being able to interact and see you do what you do.
Yeah. Yeah. And I think sometimes people know these things, but it just takes hearing it from me, right? Like, the teacher knows that she should go to the bathroom at some point during the day, but she just doesn't have time, right? Or like the truck driver, or, the nurse, we ignore these things until they get really bad. And then we think, okay, I think it's time to invest in myself.
Yeah, that's true. Well, Elizabeth, I like to thank you for coming on. I will make sure I include all your information in the description below, and that way people can get in contact with you. We'll include phone number, address, all your social media contacts. Is there anything else you'd like to say around before we end today?
No, I just want to say that if you are going through any of these things, you're not alone, and there's help out there, even though it can feel very isolating and it can feel you're alone on this deserted island with nobody there, but there's a whole community of support for you, and we're right there in the center. So just give us a call.
Awesome. Thank you so much for joining me today. And if there's anything else we can do to help you all out, please let me know.
Thanks so much.
Thank you so much, Dr. Willison.